Today, we're speaking about accelerating family caregiver-friendly healthcare in British Columbia. I'm Wendy Johnstone. I'm a gerontologist and consultant with Family Caregivers of BC, and I'm here with Jules Andre Brown, who's also a consultant with Family Caregivers of BC, and we are two members of the Caregiver RX project team. So welcome, and we're really excited that you're viewing our presentation on accelerating family caregiver-friendly healthcare in British Columbia. Next slide. A quick introduction to Family Caregivers of British Columbia. We're a nonprofit charity that's dedicated solely to the well-being of family caregivers. We're a provincial organization, and for the past 5 years, we've been part of the Ministry of Health's Patients as Partners initiative. We have three main pillars: caregiver support, education, and caregiver engagement. As you'll see on this slide, there are a wide variety of ways that we directly support caregivers through our caregiver support line, through caregiver coaching, through support groups, and our online resource center. We provide education for healthcare professionals, as well as to and for family caregivers. And we look at caregiver engagement to improve the quality of care, that family caregivers are engaged in healthcare systems. We have family caregivers that participate on healthcare committees, and we look to collaborate with other like-minded organizations in the community, with Ministry of Health research and initiatives, as well as within authorities and primary care networks. Next slide. The definition of a family caregiver is a family member or friend who gives unpaid care and support to someone living with disease, disability, or frailty due to aging. And the role of a family caregiver is typically determined both by the person receiving care and the person providing care. Next slide. Currently, in British Columbia, we have over 1.3 million family and friend caregivers. That's an estimated 28% of our province's population. Next slide. Caregiving is big, and what we see is really the tip of the iceberg. What we don't see is that caregivers are providing up to 80% of the care required for someone to be able to remain independent in their home, receive the proper support to enable independence, to help with various treatments and everyday living activities. There's a ratio 10-1. So for every hour that the public healthcare system is providing individuals that need care, caregivers are giving 10 hours. Next slide. Recently, what we're seeing, and this has been supported through the report from the Seniors Advocate, is the impact of caregiver distress. So what we're starting to see more and more of is that caregivers are getting sick and they're getting burnt out, that they're no longer able to continue to support the care recipient in the community. Our community services and publicly funded system is already strained, and we're struggling to find a way to fill the gap, and it's putting more pressure on family caregivers and more pressure on our systems. And it typically can lead to increased utilization of acute care facilities and hospitals, and driving the cost of care. Next slide. On our caregiver support line, we receive calls from family caregivers all across the province. And our main role is we provide emotional support. We understand the caregiving situation. We provide suggestions on how to navigate the healthcare system and how caregivers can prioritize their own well-being. As you'll see in the bottom left-hand corner, the caregiver concerns that we hear most is information referral. So information about their caregiving needs, information about disease and illness, information about next steps on how to navigate the healthcare system, where to find community support, and also where they can find peer support for themselves. We also think it's really critical that family caregivers put their own oxygen mask on first, so that they're able to continue caring for their care recipient. We do our best to provide an up-to-date list of resources across the province that family caregivers can tap into and can utilize in their own local area. We partner with different organizations to be up to date on their list of resources. And again, we provide caregivers with support and guidance on how to navigate the healthcare system and how to link themselves, or we will help link them to various supports in their communities. Next slide. This idea of promoting family caregiver-friendly healthcare is looking at how do we bridge patients or the care recipients' needs with family caregivers' needs and with the provider's needs. And how do we communicate collectively as a whole in the best interest, of course, of the care recipient and patients, but also for family caregivers and their needs in order for them to be able to provide support to the people that they're caring for. And how do providers communicate both with family caregivers and with patients or the care recipients? And how do family caregivers communicate with providers and ensure that there's a holistic approach to caring? Next slide. One of the main areas that we want to impress upon healthcare providers is this idea of how to identify and refer caregivers for support. Next slide. One of the greatest challenges that we face, and as healthcare providers face, is that family caregivers don't self-identify. Generally, their focus is so much on the care recipient or the patient or client that they often don't identify as a family caregiver. Healthcare professionals are in a very unique role where they can play a real pivotal role in encouraging family caregivers to identify or to bring awareness into their needs as a person of support or as a family caregiver. And so the role within the Caregiver RX project is to provide opportunities to shift culture to identify, support, and include the family caregiver. And what we typically see with family caregivers is when you ask them how they're doing, or when we try to bring awareness, they'll say, no, I'm fine. And then all of a sudden they're not. And so we're trying to move the needle more to the left-hand side of the chart, where we're trying to open up those conversations and try to help family caregivers identify their own needs in order to be able to continue to care, or care in a way that doesn't compromise their health. Next slide. I'm going to hand it over to Jules at this point in the presentation, and he's going to take the second half.
Great, thank you, Wendy. So we'd like to talk to you about how family caregivers feel. This comes from family caregivers about how they're experiencing their navigation throughout the healthcare system. And we talked about how caregivers and their ongoing well-being, and how we know that healthcare providers want to help and improve the caregiver experience. So we've listed 3 ways that caregivers define what's important in their support. And the first is that caregivers do not want to feel invisible in the process. So a simple way to do that is to kind of identify both yourself and the family caregiver with a simple, warm introduction with your intention to help, and ask, are you caring for a family or friend? And many family caregivers mention that these short introductions, the warm tone, the eye contact, and the opportunity to just be seen goes a long way in their own feeling of safety and security and ability to do their caring. The second point is that there's a feeling of uncertainty, and what we've said here is sort of, if they're unsure, refer. And that second point is that healthcare providers can help tremendously with helping ease feelings of uncertainty, simply letting people know that they're in the right place or in the wrong place, or that you're going to help them find the right resources is a great relief to family caregivers. And the third point is that family caregivers can benefit from being asked how they're doing. And family caregivers, as you saw on the last slide, it's often they haven't had a chance to self-identify or even check in with themselves because they have a feeling that they should be fine. So family caregivers are focused on their loved one, and being asked how they're doing is quite helpful to them. And even if your practice is unable to provide some direct services, a listening ear is a great first step. And in the next few slides, we'll show some resources where you can refer these family caregivers if it's beyond the scope of your services. So we know that evidence shows that family caregivers who are supported early in their journey have a much better chance of sustaining their role, and that caregiver support is critical. Supporting family caregivers, once a family caregiver reaches out, there are many ways they can be supported. And we know that healthcare providers are just so paramount in helping them take that first step. And we'll show later just an incredible sort of data on where that's coming from. Our project is the Caregiver RX project here at Family Caregivers of BC, and we're all about the sort of community development approach used to integrate family and friend caregivers into primary care, and furthering a person and their family-centered care. We engage collaboratively with health authorities, divisions, community organizations, and we've just really benefited from the connection that different healthcare providers, physicians have offered us in the last couple of years. So we're really just expanding on that because it's where people really identify as an important part of their journey. We have two ways that we offer for helping people be referred and supported by us. On the left-hand side, we have a referral form. And if you're able to sit down with somebody, we have this form that you can fax in or call us or email directly to us, and we'll follow up with them. And family caregivers really welcome this because it's one less thing they have to do. It just means they can, they know a call's coming in a couple of weeks and someone will follow up with them, and they can sort of schedule it. They don't have to remember one more thing to do. And often it's an opportunity to sort of open up about a lot of the things that are going on for them, and to get some resources they didn't know were even in their purview. So it's quite a valuable tool, and you can get their consent sort of quickly at the bottom and fax off, and we'll follow up. It's really been quite valuable. And then we also have a way that's more of a proactive approach, where we have a tear-off pad, which you can see on the right, and it's in yellow, where it gives people our direct support line, which is 1-877-520-3267. And this card, or sort of tear-off pad, is helpful just to sort of, highlight some of the things we're doing. Some people leave it out in their office or in places they know healthcare providers congregate, or we've seen this a real popular way is to put it inside of a binder that's going home with a family caregiver on how to help some of the, say it's medication or some of the local services. So yeah, it's just a nice kind of proactive way to help inform that. So here again is our referral form, and with caregiver consent, allows us to initiate contact, and This can be filled out directly on our website, or it can be downloaded so you have copies, physical copies, and you can fax them. Again, you can email it, and if you lose it, we have it on our website on the, if you go under Get Help, Refer a Caregiver, or our education resources. But you can always email us. Our email's at the end of it, and we will send you a copy. And here is just a full screen version, so you can see the Caregiver RX tear off pad. And yeah, again, it can connect people to sort of emotional support, navigating the healthcare system, and some of our support groups and newsletters. And it's really helpful if you only have a moment or two in your work, or someone's kind of jetting out. This is a quick thing you can give them. And this is a family physician in Nanaimo, and she uses our Caregiver RX pad all the time, and is greatly supportive of it. And we are supportive of all the physicians and healthcare providers that are using it or referring people. So we really support it. And the referrals from our healthcare providers have been so helpful, and it's just a great sort of collaboration. As you'll see here, there's sort of such a big jump here. You'll see in the red there, just kind of an amazing increase over from 2007 to 2020, and GP referrals as well on the bottom there in blue. But they make up just shy of 30% of all of our caregiver support line referrals. And, you know, we know that number is growing, and we know that that's a welcome place, and we've just really appreciated that support and connection from different parties. And of course, we've also enjoyed in our on the right-hand side there, you'll see the engagement and collaboration. I think we learn a lot from healthcare providers about how we can engage with healthcare providers and systems, but also with family caregivers. So we really welcome those opportunities to help make some connections and participation on committees and collaborate. It's just something we really value, and we know it's been valuable for those family caregivers. So again, we have a support line, support groups, and sort of a resource library with some newsletters, publication, podcasts. There's a lot of resources there for anyone looking to learn more about family caregiving, and you know, the podcasts are a wonderful sort of warm way to get involved in that if you just only have a few moments. So there's lots of tools there. There's quizzes, which is a really kind of helpful way that people identify as kind of letting them know where they might be feeling a gap in their support. So before we leave, Wendy, is there anything you wanted to mention?
I think you've captured it all. Thank you, Jules.
Yeah, no problem. Well, we are always welcome to hear from you, and our email is caregiverrx@familycaregiversbc.ca. And yeah, please, I'm Jules, and this is Wendy, and yeah, thank you so much for joining us today.